Hi guys, so today I'm going to be doing a video on what's in my nursing bag, and this is an updated video from what's in my clinical bag, which I will link down below. I did a video back when I was in nursing school on what's in my clinical bag, but times have changed and I am now a nurse and things in my bag have slightly changed as well. So I'm going to go over what's in my bag, and I want to apologize in advance. I have been sick the past few days, and if you follow my Instagram you know that one of my cats has been sick as well, so I've been very emotional and I'm emotionally and physically drained. And so I apologize if I sound or look not as well as I normally do, but I still wanted to put up this video for you guys since I skipped Saturday's video because of everything that was going on. So this is the bag that I bring to my nursing shifts every day, and it is kind of big, but the reason why it's big is because right now I have all of this paperwork and stuff that is in there, because since I just did my orientation I had all this like paperwork I had to fill out and all these check marks I had to like check off and things I had to get signed, and I haven't been able to go over it with my manager yet, and so I bring it to every shift just in case we're going to be going over it and if I need to look something up or write something down. So eventually I'm probably not going to be taking this big backpack back and forth to my nursing shifts and to work, but for now this is what I have. So I'm just gonna go over everything that's in my bag here. There's a lot of things in here that I actually use, and there's some things in here that I just have in here because it's like a bottomless pit. It's like your purse. You just start putting random things in there and you collect things over time. So I mean, I don't know, we might find something interesting in here. So first and foremost, I always have my stethoscope. That is a given. I bring my stethoscope to every single shift. In this front pocket here, I'm gonna go over everything that I shove in this pocket. For some reason I have a thermometer in here. I don't use this on any of my patients. I just have it in this backpack because I guess I just thought I should just put it there. But just to clarify, I do not use my own personal thermometer on my patients at work. The next thing I have in my bag is my ID badge, and on the back of my badge I have a little flashlight. And this is super helpful for when it's getting late out at night and maybe my patients are sleeping and I just need to do something quick in their room but I don't need to wake them up. I love having this flashlight just so I don't have to turn all the lights on. I can just use my little light and shine it on the IV pole or hang a new bag of fluids or whatever I have to do, and that way it doesn't hopefully wake up my patients. I have some Coban and some transparent tape in my nursing bag that I usually put in my pockets before my shifts. This stuff is stuff that I have accidentally brought home in my pockets, along with all of these alcohol swabs that are in my bag. I just have this stuff in my pockets and I accidentally come home with it in my pockets after my shifts, so I just end up putting it in my bag so I can reuse it like on my next shifts, as long as it's like all intact and clean and all that. But yeah, so I have tape and Coban because those are things that you use a lot during your shifts, and it's just just stuff that I have taken home. The next thing in my bag is my scissors, and I do not know how I went through nursing school and survived my first few shifts without scissors, because now that I have them in my bag and I carry them with me throughout my shifts, I use them all the time. It saves me so much time from just like struggling to rip off tape or struggling to like take, you know, something, if a patient has like tape wrapped on their arm for their IV, if I need to take it out or redress it or whatever. These have saved me so much time, and it is a nursing must-have. I didn't have it in my last clinical bag video, but if you do not have scissors, you should get some because I use them all the time. The next thing that I found in my bag is about 70 jillion pens. I didn't realize that I have all these. I don't think these are all my pens because I don't remember putting these in my bag for my own personal use. What I think happens is throughout my shifts, I leave my pens somewhere, I pick up someone else's, and by the end of my shift, I at least have, you know, 2 in my pocket. And over time, I have magically collected a bunch of pens. But these are definitely nursing must-haves because you are constantly always writing things down, signing things, and so I always have 2 pens in my pocket when I'm on my shift. But I have 1, 2, 3, 4, 5, 6, 7, 8, 9 pens in my bag, and I think I started off with 3, so I apologize to anyone whose pens I have stolen. It is definitely not on purpose though. The next thing in my bag is Carmex. I always carry around Carmex. I am a Carmex fanatic. I'm a chapstick fanatic. I always have to have some sort of lip moisturizer on me wherever I am. I have to sleep with it under my pillow because if I have chapped lips, the world will end. So I always have Carmex with me. The next thing is my nursing watch. This is just a very simple, it is a Casio nursing watch. I believe it was like $17 off of Amazon, and it's plasticky and it can be cleaned, and I did not want an expensive watch for nursing because it just, you know, it gets sturdy and you have to clean it off, and I don't want it to, you know, get ruined. And so if you watched my clinical bag video, I had a different brand of nursing watch, but that one ended up breaking after a while, and so I just got another cheap watch, and hopefully this one will last me a few years. The next thing in my bag are like a jillion ponytails and some headbands because I don't like going to work without having a ponytail because I'm usually putting my hair up. But it's funny because I'm always seeming to look for where my hair bands are and I can never find them. And now I just found like 5 of them in my bag, and so now I know where they're all going to. The next thing I have in my bag is just some lotion and some hand sanitizer. Why I have hand sanitizer in my bag, I don't know. You use it so many times throughout your shift, by the end of your shift, you don't want to put any more hand sanitizer on. So I just thought, when I was packing my bag for my first shift, I was trying to be like super prepared and brought hand sanitizer, but I never carry this around. I have never even used this bottle. So it's in my bag. I don't use it. Lotion. Same with this lotion. I thought my hands are going to get so dry during my shifts, which sometimes they do, but I realized that my work has 2 types of hand sanitizer, a normal kind and a moisturizer kind. And since I've been using the moisturizer kind, my hands have been a lot softer, which has been awesome. And so I've just been using that, and I don't need any lotion afterwards. The next thing is just some ibuprofen. You never know if you're going to get a headache, get cramps, start feeling sick. So that's my emergency bottle. And that's pretty much it, besides just some more alcohol swabs. I have an IV cap in here. Random stuff that I bring home from work. Alright guys, I hope you enjoyed this video, and thank you for watching. If you want to see my clinical bag video on what I brought to clinicals during nursing school, I will link that below. If you have any questions or want to know where I've gotten certain products, ask me that in the comments below. Give this video a big thumbs up and subscribe to my channel, and I'll see you next time. Bye!